Hey everyone, what's up? This is Dr. Charlie PT. Hope you are doing well. Appreciate you checking out my channel. For those of you new to my channel, my name is Dr. Charlie. Again, I am a physical therapist. I have my orthopedic board specialty, and I teach people all around the world with unresolved back, butt, and sciatica problems how to fix themselves naturally using the power of mind and movement as medicine. Essentially, I want to give you all the tools, knowledge, and resources in my head so that you can think independently and be self-sustainable long term. All right, so in this video, I want to share with you a post. A lot of content is inspired by posts and just interactions with people like you who are in pain. It's from an individual named Nick inside of my private coaching program. I'll try to put it over here somewhere, who's been dealing with some just back and sciatica type stuff like everybody else I worked with, right? And just one tip, a few days into the program, was able to completely shift his pain experience from feeling completely uncomfortable doing just basic everyday tasks to having the best 3 days he's had in 7 weeks, just again, from one little tip in a few days inside of our private coaching program, the Glute Relief Accelerator program. All right, so first things first, let's just read through the post, all right? All right, everyone, clearly a new day because I have no hair here, but I wanted to read this from Nick, all right? Excellent tip. Replayed Dr. C's coaching calls at the end of last week. The suggestions to train everything else you can in the gym, aside from what is feeling aggravated, has effectively shrunk in one gym session my area of pain. Instead of my whole body being out of commission, my focus has reduced to the smallest area of what is basically square inches. Love the excellent adjustment and perspective. I just started this program last week, but I'm enjoying the best 3 days I've had in 7 weeks just from this one tip. Thank you. Another one, too, that came in from Josh. What did he get from one of the checkpoints in the program? Learned that I can use 75% of my body that is not in pain to help with the 25% of the body that is in pain when it comes to looking for motions. Found that push-ups from my knees and lying on my right hip with my feet and legs / head and chest elevated can correct my lateral shift and is not painful. How cool is that? So to summarize, the nugget and or the main message, if you will, behind that post is to focus on what you can do, not what you can't. Now, that sounds like really elementary. And you're like, okay, dude, so he paid you to tell him that? He did, all right? But there's just so much information out there that people make healing complicated. Healing does not have to be hard. And we tend to overcomplicate it because we think our problems are complicated or complex. And therefore, the solution must be somehow or inherently complex or complicated, right? If I've got all this stuff on my imaging, or I've got all these aches or pains and they're all over the place and I've seen all these doctors, right? There's no way it could be as simple as focusing on what I can do versus what I can't. That's silly, Charlie. Be positive, don't be negative, right? Focus on yummy, not on yucky, right? But it's a massive perspective shift, as Nick put it. And more than anything, that's what people need to heal. They don't need fancy exercises most of the time. In fact, most people inside of our private coaching program do one or two things, even if they've had pain for, I've treated people with up to 45 years of pain. And the process is exactly the same. People think their problem is different or somehow unique. Just like they think, well, this tree's different and that tree's different. We can all agree upon that. But it all started with the seed. The same kind of idea, a seed. And they all needed water, and they all needed sunlight, and everything has to go through the same process. Everyone in pain has a very similar pain experience. If you're a human and you have a brain, well, then you have a similar pain experience, even if your pain is slightly different. And you can boil it down to a pain relief process. By the way, if you're interested in learning a little bit more about what that process is and how we teach people worldwide with unresolved back, butt, and sciatica problems how to fix themselves, well, then check out my free workshop above. Okay? But essentially, at the end of the day, focus on what you can do, not what you can't. So, if you have some type of injury, like Nick, and you're watching this video, and you're trying all kinds of stuff because your butt cheek hurts, you want to massage your butt cheek. You want to stretch your butt cheek. You want to get adjustments or dry needling on your butt cheek. You could do that, but what you're failing to recognize is this idea that the human body is a system. Yes, there are isolated bones and joints and muscles and things like that, but we operate and we function as an integrated system, as a unit, one unit, which means that if you have a pain just in the butt, just down here somewhere, Well, that's only one gear or one part of the system. That's 2% of the entire system, of the entire unit that's down and out. And what's the natural tendency? Well, just to rest the whole thing. If you're at work and one department goes down, if one person calls out sick, do you just say, shut the doors, we can't operate today? No, you don't. That would be silly, right? That would be focusing on lack. But that's what people do when they're in pain. Right, I had a woman reach out to me recently who her daughter fractured something in her right leg. Doctor said 6 to 8 to 12 weeks of rest. What? That's a really bad idea. Just because your right kneecap isn't functioning properly, you have to rest your entire body. That's one way not only mentally to depress an athlete and or anybody who moves, which is everybody in this world, last time I checked, right? And enjoys movement, but then also physically to decondition the entire system. You have a heart, you have lungs, you have a digestive system that is all aided by movement. You have a lymphatic system. There are many different systems and tissues in the body just outside of the area where you hurt that benefit from activity, physically, and then also your brain, mentally, right? And so if you are in pain right now, you might be wanting to focus on that which you can't do, but leverage what you can do. If your right leg hurts, do everything you can to strengthen the left leg, or work the left leg, or move the left leg. If your right leg hurts, do everything you can to get your belly strong. Move your trunk. Still go to the gym and get jacked in your upper body. Just because someone calls out sick, just because your right hip is a little wonky today, doesn't mean that you need to shut things down. In fact, it's just an opportunity to leverage, again, what you can do. And oftentimes, if you can leverage what you can do, then you can fix what can't do. Now, I can hear the comments now. But Dr. Charlie, working my arms won't fix my sciatica? Not in the old worldview, not with the old paradigm, not with your old understanding of the way the body is sort of connected. But are you telling me that your arm is in a different body than your leg? Is that what you're telling me? And so if we can agree upon the fact that your arm is not outside of your body, it's not in a different body than your leg, then how is it that working what you can do, even if it's in a seemingly unrelated part of the body, a different part of the body, other side, upper body, trunk, somewhere else, or other than where you hurt, how is it that that area, or moving those areas, those things that you can move, couldn't somehow influence that which you can't move? If you accept that the body is a system, and you apply the systems theory thinking, then you have lots of ways to resolve your pain. Lots of ways that you didn't even think of, because all you were focused on is the one area that hurt. And so we kind of shifted Nick's perspective. He thought, yep, see, I hurt, can't go to the gym, my back hurts. But your arms don't hurt. Your right arm doesn't hurt. Your left arm doesn't hurt. Your neck doesn't hurt. Your trunk doesn't hurt. Your other leg doesn't hurt. So why are you not using those? And so we tend to go to the extremes of, I hurt, I can't do things. But you can. Just like the lady with the kind of wonky kneecap who reached out to me. She should be working her upper body, working her good leg, and just going all out, using this as an opportunity to leverage what works well to fix what doesn't work well. Using yummy to fix yucky. And if at the end of the day you're someone who's like, hey, but using my upper body or using my good leg, how's it going to fix my bad leg? Then you're missing the point. Because I would say this to you. You can be in pain and you can not do anything. Or you can be in pain and you can do anything that you want outside of the area of injury. Get strong in your upper body, get your heart and lungs in better shape. Which would you prefer? Be in pain and do nothing? or be in pain and do something. And if you're one of those people who says, I'd rather be in pain and do nothing, okay, so be it. Do it, try it, see if it works. But if you're somebody who says, you know what, if I'm gonna be in pain, I might as well focus on what I can do versus what I can't do. Regardless, this is the key, regardless of whether it resolves my pain. I know you all are here because you're in pain and you want help, but can you just, and are you willing to, get out of your own way for just one moment and say, you know what, what's the alternative to just resting and not moving and not going to the gym? Regardless of if it fixes my pain or not, I'd rather stay as active as possible. And this is just one way to do it. And Nick was able to take that, which we were actually sharing with someone else in the program on a coaching call, which is a part of the program, where we kind of get everybody involved. We've created a community of hundreds of people going through very similar things as you may be going through, so that you can learn from other folks. And that's what's so cool, is you can leverage that which we're sharing with other folks. You can learn, then you can do and you can apply, just like Nick did. And then Nick spits it back out. Learn, then he does, and now he teaches. He shares with other folks in the community. And so take what nugget you can from this, stay as active as you possibly can, and instead of focusing on what you can't do, focus on what you can do. Let me know your thoughts below in the comments. Be sure to hit the like button and subscribe to the channel if you found little nuggets like this useful. Again, less equals more. Sometimes you don't need that sheet of exercises. You don't need to do more to get better. Boring is better. More just equals more confused. And sometimes just one little nugget away, one little motion away maybe, from resolving months, years, and or even decades of pain. Subscribe, hit the bell for notifications when we go live with new videos every single week. Thanks so much, everyone. Appreciate you checking out my stuff.